Our next talk is from our own Dr. Lauren Stadler here at Rice. The title of her talk is Spatial and Temporal Surveillance of Houston's Wastewater to Track Community COVID-19 Infections Dynamics. Lauren, thank you for being here today. Please feel free to take over.
Thank you so much for the introduction. Okay, can everyone hear me and see the screen? Okay, I'm going to assume yes, here we go. So I'm an environmental engineer, and today I'm going to be talking about this large collaborative effort that I've been working on, really led by the Houston Health Department since the onset of the pandemic, to use wastewater monitoring to track infection dynamics of SARS-CoV-2, which is the virus that causes COVID-19, in our communities here in Houston. Before I get started, I just want to make sure that I acknowledge this great, amazing team that I've had the opportunity to work with. This has been led by our health department, but many folks from Houston Public Works have helped us gain access to get these wastewater samples. A great team at Rice University, Kathy Enzer in the statistics department, many students, staff have contributed to the analysis of these samples. We've worked closely with the Taylor Lab at Baylor College of Medicine to do the viral analysis. And this project really started as a seed grant that came from Rice and also from the National Science Foundation, and since then has been picked up by our health department for support. Okay, so to start, I just want to introduce what I mean by wastewater surveillance or wastewater monitoring. So as an overview, it turns out that a large portion of individuals that become infected with SARS-CoV-2 shed that virus in their stool. And researchers have shown that this occurs in infected individuals that are both symptomatic, but also, very importantly, asymptomatic. So then when you go to the bathroom, or when those infected individuals go to the bathroom, their stool enters the sewer network and becomes part of the wastewater that is transported through that sewer network to our wastewater treatment plants where it's treated. We grab these samples before they are treated in our wastewater treatment plants, and that wastewater sample, or that sewage sample, I kind of use those interchangeably, that represents an aggregated or pooled sample from all the individuals that go to the bathroom that are served by that treatment plant. And then we can analyze that sample for SARS-CoV-2, that virus that causes COVID-19. And those results can be either qualitative, so just is the virus there or is it not, but they can also be quantitative. And so we've been taking this quantitative approach where we've been actually trying to quantify the concentration or the loads of the virus in these wastewater samples so we can compare it both over time, but also over space. There's a number of different reasons why people are really excited about using this approach to monitor communities and track disease burden and infection dynamics. So first is that we know that diagnostic tests are likely only picking up a fraction of the total SARS-CoV-2 infections. Many people are asymptomatic or only mildly symptomatic, and so they might not go get tested, but that doesn't mean that these people are not involved in the spread of the virus. And even if you do get tested, which means you're likely someone who's experiencing some symptoms, there's often a lag time between when you get tested and when you get your results back. And at the beginning of the pandemic, that lag time could have been on the order of even 10 days. And that's 10 days of precious time that if you didn't change your behavior would result in the spread of the virus in your community. Wastewater could serve as a complementary tool. It's not meant to replace diagnostic testing, but to be complementary to serve as an early warning system for outbreaks. Wastewater monitoring is much less expensive than mass surveys where you actually have to randomly select individuals to test because, again, wastewater represents this pooled community sample. And it allows you to get coverage in areas where there's little access to testing facilities or where there's just little clinical testing going on. And then depending on how it's implemented, it can actually be used to identify geographic areas of concern or specific communities that are experiencing high disease burden. I want to make sure that I mention this is really not a new approach. Researchers have been using wastewater monitoring, or something that we call wastewater-based epidemiology, for some time now. And it's been used to detect numerous other viruses, including poliovirus, and also a number of other gastrointestinal viruses like adenovirus, norovirus, and rotavirus. In these previous studies, it's been used to survey unvaccinated populations, and again, serve as an early warning of outbreaks and really trigger the administration of vaccines in communities if a disease were to pop up again. It's also been used to actually go in and sequence the viral genomes present in the wastewater to understand what genotypes or what strains of virus are circulating in a population. And so, of course, when the pandemic hit, immediately researchers were interested to see if they could also use this approach to look for the virus that causes COVID-19 in our wastewater. And so there's been some really exciting press on a lot of the success stories where wastewater monitoring has been successfully implemented to detect virus before an outbreak occurs. So just two quick examples I'll point out is one at the University of Arizona. So when college students were all moving back into dorms, at University of Arizona, they required all the students to get tested before they moved back in and be negative. But then the students all moved back in, and then they started this wastewater monitoring, and immediately they saw a positive hit in one of the dorms. And so that triggered them to go and individually do a rapid test on all the students that were living in that dorm that had a positive hit. And they were able to identify 2 students who were asymptomatic, but that were indeed infected, and isolate them and really prevent an outbreak before it occurred. So this was a great success story, and it made a lot of headlines. And here's another one that came out of Italy that showed that they actually went back and looked at old wastewater samples all the way back to December, and actually I think even before December, and they were able to identify traces of this virus in the wastewater all the way back to December 2019, suggesting that it's possible that this virus could have been circulating in the community long before their outbreak, which occurred in March, and even before the first positive case that was reported in China. And so because of all these benefits and kind of these things I outlined in that previous slide, there's this huge global interest in using wastewater surveillance for SARS-CoV-2 that's really propelled this field forward really rapidly in the past few months. This is just a great dashboard that's collecting all the studies that are going on around the world. There are 19 different dashboards where people are posting wastewater SARS-CoV-2 data in near real time. There's I think there's 107 different universities. It might even be higher now. I pulled this, I think, 2 days ago or a few days ago. 107 different universities that are implementing this on campuses in some form. And this is going on at 41 different countries across the world. So now I'll shift to talking about how we're using this in Houston. So here we've been working with the health department and Houston Water since early May to monitor the 39 wastewater treatment plants that we have across the city. These treatment plants serve over 2.3 million people and cover 670 square miles. Our treatment plants are somewhat unique in that we don't have just a handful of very large centralized facilities. We actually have this more distributed wastewater treatment system. And so we can actually use this to get information not just about temporal, what's going on over time, but actually spatially by looking at all the different neighborhoods that are served by these different treatment plants. We've been collecting samples once a week. At some points it was twice a week, and these samples are 24-hour composite influent samples of wastewater. I just want to very briefly talk about a lot of the effort that our group has done to make sure that we have a very sensitive assay to be able to reliably detect low concentrations of this virus in wastewater. Wastewater is a complex matrix full of lots of things in addition to this virus. As you can imagine, it's full of organics, it's full of other bacteria and pathogens. And so in order to be able to detect this virus, especially to be able to detect it when only maybe a small percentage of the community is infected, we need to be able to concentrate that virus in the wastewater samples before we measure it. So the first step is concentration, and we've evaluated 5 different concentration methods to really optimize our methods so we can get the method that yields the best or the most virus in our wastewater samples. And then we've also optimized our RNA extraction and purification, which is the next step, and the quantification of these viral genomes and using different methods. These last 2 steps are very similar to how clinical samples are processed. But again, we've had the ability to test this on 39 different wastewater samples because we have so many different types of samples here. And really pick the methods that allow us to detect and have enabled us to detect virus in samples from every single site that we've sampled to date. So here's just an overview of kind of our workflow every single week. 24-hour composite influent wastewater samples are collected from these 39 sites. They are transported to our centralized laboratory facility where they're split into bottles that then are distributed between two independent laboratories, my laboratory at Rice University and then the Taylor Lab at Baylor College of Medicine. And we independently analyze replicate samples from each site. And we're doing this at two different labs just so we have validation or a check between our labs to make sure we're seeing similar trends. And again, because a lot of these methods we're kind of developing in real time for actually doing this wastewater measurement, we wanted to make sure we were very confident in the data that we were getting, especially if our health department was going to use it to make actionable decisions about where to send strike teams. So then we report out these concentrations from these 39 samples that we measure every single week, and we hand over those results to Kathy Enzer's group in the statistics department here at Rice. She's developed a statistical model that takes that information and uses it to basically track the trends in viral load at each of the sites over time. And this is used to identify geographic areas of concern where we see significant increases in viral load every week. That information is then relayed to the health department, and that's used to inform interventions, including trying to increase testing, so mobile testing units, but also education and strike teams to tell people and message about how to stop the spread of the virus. This is an example of an output that we generate each week that's used by the health department to understand the week-to-week trends in the virus loads from each of the wastewater treatment plants. So here, this left plot shows all the different wastewater treatment plants that we've been sampling. The green bars indicate there's a statistically significant decreasing trend in virus load at that location for that week. The gray bars means there's no statistically significant change in the viral load from week to week. And the red bars indicate there's a statistically significant increase in viral load. This information is displayed spatially on the map on the right. And again, now the health department can use this information, this trend information, in addition to the magnitude of the viral load to make decisions about where to allocate healthcare resources. One of the reasons that we feel confident as a team in using this wastewater data to actually inform interventions is because we've amassed a sufficient amount of longitudinal data at this point, such that we can compare it to clinical positivity rates to show that they track very well with each other. So here I'm showing the average wastewater viral load trend for 16 treatment plants that we've been tracking since early May, and that's shown in this green line here. And we've taken these observations, averaged them together, and then fit them with a nonlinear regression. And then this gray bar represents the 95% confidence interval around those observations. We can then compare that to the clinical positivity rate. And so that's what's shown here in the blue. Each of these blue crosses represents an observation. The dark blue line is the 14-day moving average. And then this lighter blue line is just, again, the nonlinear regression fit to these observations. And we can see a strong correlation between our wastewater trend and our clinical positivity rate trend with a correlation coefficient in this case of 0.84. We've also performed a cross-correlation analysis between these two series, and we see that wastewater information can provide actually up to a 2-week leading indicator of positivity rate changes. And so again, this just demonstrates that this approach is sound and that it can actually potentially be used to get an early warning on when we'd expect to see rises in cases. We performed a similar analysis comparing wastewater viral load trend to clinical positivity rate trend for each individual wastewater treatment plant that we've been sampling. So here I'm just showing 6 different wastewater treatment plants that vary in size and population served. So 69th Street is the largest treatment plant that we have here in Houston, and these all are ordered in descending size. And as you can see, we again see very strong correlations between this non-parametric model fitted to the wastewater data and the positivity rate data, showing that this approach is robust across a range of different wastewater treatment plant sizes and could be applied to other cities where perhaps they have much larger, more centralized facilities like 69th Street, or smaller treatment facilities like, for example, WCID 47. Now, coming back to, again, how this data is being used, it's primarily being used to do two things. One is to assess trends at individual plants, so basically identify areas with the greatest rate of change in virus loading week over week, and then also to assess the magnitude of infection by each sewer shed by looking at the total viral load in each sewer shed. So here I'm showing this heat map is showing the population normalized viral load at every single week that we've taken samples. And as you can see, things are definitely better than they were when we started this campaign, and overall viral loads are lower than they've been really at any time. But they've since basically plateaued since September. So things aren't continuing to get significantly better, but they're just kind of plateauing at the moment. We can look at this data in a slightly different way. So instead of looking at population normalized viral load, we can actually look instead at the change in viral load from week to week to really see where and when things are getting better or worse. So this is kind of similar to the trend plot that I showed earlier for one single week, but now we're looking at it for every single week that we've been sampling. So as you can see, the surge that occurred in June, late June, early July is extremely apparent because we saw basically across the entire city a worsening in terms of viral load at almost every single site that we're sampling. And since then, it's actually been quite a bit more heterogeneous. And this makes sense if we think about how this virus spreads. It's not homogeneously impacting the entire city, but instead it's occurring in localized outbreaks in specific parts of the city. And because we have these 39 sites, we can actually use this approach to identify specific geographic areas that are experiencing a local outbreak. This information each week is sent to the health department, and the trend and the magnitude of the wastewater viral load and the estimate of the number of individuals in each treatment plant service area is used to prioritize areas of the city for targeted response actions. And so this is just a list of the different variables that the health department uses to make decisions and basically prioritize the top 15 zip codes for which they're going to send strike teams. And those strike teams consist of people who actually go door to door and try and interact with people and educate people about the virus, identify the nearest testing locations where they can go get a COVID-19 test. And there's also these mobile testing units that are also prioritized in a similar way that are sent into communities to increase clinical testing penetration in these communities that are being hardest hit. So because we saw such a strong correlation between the wastewater viral load data and the positivity rate, what we're trying to do now is actually use the wastewater information to predict positivity rates or infection burdens in our communities. So here I'm just showing two different predictive models that we've tried out. Both models were built using all the longitudinal data that we have collected over the past 23 weeks. This first model predicts the positivity rate using the current and 2 previous weeks wastewater viral load data. And this second model is a true 1-week prediction using only the previous 2 weeks wastewater data to predict the current week positivity rate data. And so I'm showing a comparison for both of these plots of the predicted positivity rate on the y-axis and the smooth positivity rate that we actually observed on the x-axis. And as you can see, there's a pretty strong indication that the wastewater can be used to predict positivity rate. Here I'm showing now how the outputs of these models are compared. So here on the top, I'm showing for one wastewater treatment plant, the output in terms of the prediction from these models overlaid over the actual positivity rate date. So the individual observations are the circles, and the smooth positivity rate is this gray line that is below this. And as you can see, these models do appear to track very well with the observed positivity rate in some of our sewer sheds. And then on the bottom, I'm showing a sewer shed where there's very little positivity rate data. And that's because there's just very few clinical tests being performed. So we excluded, if there were fewer than 4 clinical tests over the week, we don't calculate a positivity rate. And as you can see, like in some sewer sheds, there's just not enough clinical test information to be able to confidently estimate a positivity rate. And this is where wastewater data should be coming in to fill in the gaps. We could use the wastewater data to essentially be the primary form of community health monitoring and track infection dynamics in these communities where we're just getting very little clinical information to monitor what's going on in those communities. And this is the last, data slide that I'll show. So one of the pipe dreams and one of the real goals that we'd like to be able to work towards in wastewater-based epidemiology is to be able to go from a measured concentration of a virus in a wastewater sample to actually being able to estimate the number of infected individuals in that community. Right now, we're far from being able to do this, and we're because of many sources of uncertainty, including one, we don't have a good sense of how much virus is excreted per infected person and how long they excrete the virus, or how variable that is across different individuals from different demographic groups. And we also don't have a great sense of what's going on to the virus when it's being transported through our sewer sheds, especially in our extremely large sewer sheds. This virus is probably it's undergoing decay and lost during this process of it getting to the treatment plant. We're actually grabbing the sample. Despite these large sources of uncertainty, we do have some evidence that this may be possible eventually, albeit with a significant amount of uncertainty in the estimate. So here I'm showing the total viral load for each of the wastewater treatment plants that we sampled from, plotted against the total cases in that wastewater treatment plant service area. And this is over the entire study period. And so each of these triangles represents an individual treatment plant that we sampled. And the green is the treatment plants that we've been sampling since early May, and the rest are the treatment plants that came online or that we started sampling in July. And again, we see this extremely strong correlation between the total viral load and the total number of cases, suggesting, as we expected, that viral load will be reflective of disease burden in these communities, and suggesting that we could maybe potentially use this to actually estimate the number of positive cases in communities down the road. So to conclude or to summarize, we developed sensitive assays for detecting dilute concentrations of virus in wastewater reliably at 39 sites across Houston. We've quote unquote tested 76 million people because we've been sampling wastewater since early May. This is a much more cost-effective means of surveying the entire population in Houston weekly if we compare it to the cost per person to do individual nasal testing. We can analyze the entire city's wastewater and get a snapshot in time in just 2 to 3 days. We've shown that wastewater can provide a 2-week lead time relative to clinical testing indicators, and that wastewater viral loads correlate with positivity rate for both large and small sewer sheds. This data is being used by our health department in real time to inform local public health interventions. Ultimately, we hope that this research and efforts, not just by our team, but by the entire community working in this space, will result in an effective national wastewater surveillance system, not just for this pandemic, but for future pandemics and for other infectious diseases. And that wastewater can be mined as a valuable source of information on community health. And with that, I will conclude, and I'd be happy to take any questions. Thank you.
Thank you, Lauren. That was a great talk. You mentioned basically there being a 2 or 3 day lag between, getting the samples and then getting the results and being able to pass that on to, I guess, the city. Is that possible to improve that, or is that just a limitation of,
Yeah, it's definitely possible to improve it. And actually, we're working on some ways of making the entire thing more high throughput. It's right now, this started out as all hands on deck, many students just kind of working together, but we are by no means, for example, a commercial laboratory. So there's many economies of scale that can be taken to essentially reduce the throughput. The slowest step right now is really this concentration step. So where we actually try and take large-ish quantities of wastewater. It's a balance depending on how much virus is in them and how much we need to concentrate, and get it down to volumes that we can work with and actually quantify the virus in them.
You mentioned basically Houston having 38, I think it was 30 some water treatment systems. Is that normal for a city to have so many? Is it like, how likely is it to scale to other places?
So I think it's very not normal. And actually, when I first moved to Houston, because I came from Michigan before, and then the Northeast before, I was used to being in cities that had maybe one or two massive wastewater treatment plants. Like Boston has basically two massive wastewater treatment plants. Houston has 39, and I think it's just the nature of how Houston kind of expanded and developed, and every time it got kind of bigger and bigger and spread, it just kind of brought in a new wastewater treatment plant for that community. But in this case, it's a real advantage. Could it scale to other cities? Definitely. So you don't have to collect treatment. You don't have to collect samples from wastewater treatment plants. You can actually collect samples directly from the sewer. And so you can imagine for cities that only have maybe one or two large treatment facilities, they could actually just put their samplers directly in manholes or lift stations in the sewer system and get a more geographically resolved picture of what's going on. It was just a benefit for us because we don't have to like set up all these samplers and all these locations. We could just use the infrastructure that existed in Houston, and that allowed us to kind of like hit the ground running in terms of being able to do both spatial and temporal analysis.
I have a question about, because you did correlate your results with the number of people testing positive. Did you ever compare to hospital data?
We have not done that comparison yet. We certainly could, and I know some other groups who have done that as well. I guess my thought initially, which is why we start with just positivity rate, is that I would assume that wastewater is picking up much, much more, right? It's picking up asymptomatic and symptomatic. So, and hospitalizations are probably, again, just of the positive cases, they're again an even smaller fraction of that total, number of impacted people. And so our thought was to first look at just positivity rate or, positive cases, because we thought it'd be closer to kind of the true number of infected people if we're going to compare it to some metric.
Do you think it might say something about viral load? Like, because I'm assuming people that are in the hospital probably have a higher viral load than people who tested positive.
That's a great question. And I actually think that's something that we're continually learning from in terms of like other researchers in the space, is getting a sense of how viral load changes among different types of symptomatic people. Because it might also be, a lot of people who are infected have gastrointestinal symptoms, right? And so it's also possible that the people with the highest viral load are the ones who have a gastrointestinal infection, not just a respiratory infection, right? And I think we're learning so much about how this virus, the presentation of this virus, that's going to impact how we interpret our results. But that's a great point.
I had a question here. Are there any potential privacy issues where, with very rapid DNA sequencing and DNA databases, could this technique be used for policing?
Yeah, I think there's definitely important ethical and legal issues that are going to conversations that are going to need to be had surrounding this, especially as this gets implemented all over the country. People are doing this, like I said, 107 different universities. It's people are implementing this at scale very rapidly. Right now with the information that we're getting, we have no way of identifying who that infected individual is. Of course, if I set up a sampler outside your house, that would be different, right? And so maybe I'm not going to presume to say there's a specific number in terms of population size that we should be applying this to, but I think that's a conversation that definitely needs to happen, especially as people start implementing this at more and more granular levels. At the treatment plant level, it's really, thousands of people in general that we were collecting a pooled sample from. But of course, people are putting these on buildings or putting these on, congregate living facilities now. And so we have to have these conversations about the legal and ethical issues of it.
Yeah, that actually goes back to what you said. It's kind of great that Houston has 30 some of these water treatments, because we don't have to worry about that question yet. But if you send it to another city and they start doing the more focused, now they have to worry about these questions. I had a question here. I think you later showed some data showing how reliable the detection is. Is the concentration working? But I thought the question, how can you check, was interesting.
How can you tell?
Yeah, do you have any ways of any other experiments, orthogonal ways of checking to help prove that, your results?
Yeah, so we include, positive and negative controls in each of our runs when we assay for this virus. I just want to be clear, we're not testing for infectious virus. When we detect a positive hit in a sample, it doesn't mean that there is active live virus in the sample. It just means there's a fragment of the viral genome that's present in the sample that we're able to detect. But we run all of these samples in replicate in my lab and also in another lab. And again, this is kind of like you're saying, how we want to be really sure that we're not getting results that are falsely negative or falsely positive. And that's why we have this going on in 2 independent laboratories. And both of our labs are using positive and negative controls to make sure that our results, at least internally, check out.
Someone is asking if the weekly data is available for download.
It's not currently available for download, but we are working with our health department to discuss if they want to make a dashboard type thing available. So we're working with them to determine how they want to make this data publicly available.
Is the City of Houston funding this project?
They are.
Good. Have any other municipalities used your approach?
Many municipalities are now using this approach, actually. It's so exciting to see this pop up everywhere. There's that, the slide that I showed that had the dashboard, the different dashboards gives a hint at like some of the different places across the US that are using this approach. And many universities have also started putting up these dashboards. I know, let's see, Boston has been doing it for some time now. San Francisco Bay Area. There's a lot of different cities that are using this approach now.
Do you imagine, like, let's say years from now, this is going to become part of our lives? This will, be just continually checking, for various viruses.
I hope so. Honestly, I think wastewater is a really powerful tool to assess and monitor community health, even if it's in a more hopefully passive way and not active way, this way where we're so, when we move beyond this pandemic, my group, before I got into this looking for this specific virus, we worked on antibiotic resistant bacteria. And so we're hoping we could use it to potentially look for different resistant bacteria in wastewater and understand if there's different, type of antibiotics that may or may not be more effective to use in different communities.
You mentioned earlier that Italy had evidence that basically in their data that they had, outbreaks back in December, months before they probably knew about it. Can you see a time when we might actually get to know in December?
Like when in Houston, we'll see a similar thing?
Well, if we ever have something similar happen again, that we'll know months before, the outbreaks actually take hold.
I hope so. I think, again, because we're now putting in all the infrastructure, the health department's really invested in using this approach moving forward. If we know anything about what we're looking for, we can also do a somewhat non-targeted approach. But if we have any sense of what the target pathogen is, we can begin surveying the wastewater long before we see the introduction of that pathogen in our communities in clinical presentation. And had we, for example, started this project, I don't know why, 6 months before we saw the huge surge in Houston, I guarantee you we would have seen it in the wastewater long before we started seeing this surge in our hospitals here.
I'm getting the word that I have to wrap up. Lauren, thank you so much for doing this. I really enjoyed talking with you.
Thank you so much.
Well, let me see. Everyone, our next session will be starting, I believe, in 15 minutes. You go to the web application, click on the schedule, and you should be able to see the link. Thank you, everyone, for being here. See you in a few minutes.